You're listening to a podcast from the BMA.
The BMA's General Practitioners Committee has produced a 50-point plan for the future of general practice in the UK. It's called Fit for the Future, the Evolution of General Practice. And to tell us more about it, I'm joined by Dr. Lawrence Buckman, the chairman of the committee. Dr. Buckman, why have you produced Fit for the Future?
The GPC has a whole range of policies covering a wide set of areas, and I think this document brings them together so that people can see what we stand for, what we're interested in. We're very often accused of only saying what we're against, and actually it's time we say what we were for. And this list and the descriptions behind it explain all about our views about the future of general practice. There are some 50 recommendations in total. Some are for improvements, for example, making practices more energy efficient and having free prescriptions for everyone in the UK. And some have risen out of concerns about the current direction of travel in primary care, particularly what we see as the inappropriate involvement of big business in the provision of general practice. So now we have a single piece of work containing all the GPC's current thinking about general practice, where it's now, where it's going, and what should be done to ensure that it is and remains fit for the future.
We're coming up to an election. What do you think are the most important areas the next government needs to focus on?
I think there are three. I think we need to sustain quality in a financially uncertain future. We need to ensure that GPs are able to deliver good care from suitable premises with the right teams. And we need to recognise that GPs are part of the solution for the NHS, not the problem. And we need politicians and the health service to feel that GPs are the people they should turn to provide the best care for patients in the community.
A lot of the recommendations in this report are things the government and the BMA will need to look at, but what would you like GPs to be doing?
I think we need to be much more aware of our public appearance and how we look to our patients. We need to be more responsive to them in general, and in particular I think we need to ask them what they think. And the way you do that, the easiest way, is to have a patient participation group. They tell you quite interesting things about your practice which you often don't realise, and if you listen to them and then act on their suggestions, as long as you think they're feasible, you can actually make changes to your practice that will make the practice itself more attractive and also have more satisfied customers, which is of course what we want. I think GPs need to get much more involved with supervising out of hours, and we need to be enabled to do so. That's not the same as delivering it personally, unless you particularly want to do that. And I think we need to look after doctors who are not principals, whether they are locums or assistants or salaried in any other way. Many of those people actually want to be sessional doctors. They don't want to be partners, but an awful lot of people want to have a permanent place in the fabric of the practice, and at the moment they're prevented from doing so. We need to provide more opportunities for partnership. We need to adhere to a model contract if they're employed, and we need to offer them incremental payments to reflect experience. They should not be outside the body of the practice. They should be in it and feeling part of it.
The NHS is facing a very uncertain financial climate. How realistic do you think many of these recommendations are?
I believe all of these recommendations are realistic in the financial climate. If we improve general practice, it will certainly be more cost effective, it will be more patient focused, although I believe actually that most GPs are pretty patient focused already, and it will enable the health service to deliver using a budget that is constrained. And I think we can get more value from what we deliver to patients without actually losing money if we try and change the way we work. And this set of proposals includes recommendations for the way we could do it better, and I don't believe they are unrealistic at all.
For more information on Fit for the Future and the GPC's recommendations for general practice, please visit the BMA's website on www.bma.org.uk.